Hi, my name is Dr. Eliza Thomas. The most important update in health. I'm about to share something that may completely change the way you look at the medications sitting in your home right now. Every day, millions of people take pills without a second thought. They trust that because these medications are commonly used, prescribed by doctors, or even available over the counter, they must be safe. But what if that assumption isn't always true? What if some of the very pills you rely on daily are quietly increasing your risk of serious health problems like heart attacks or strokes, especially as you get older? This isn't meant to scare you. It's meant to wake you up, because awareness can save lives. And if you or someone you love is over the age of 60, this is a conversation you cannot afford to ignore. As we age, our bodies change in ways that many people don't fully understand. The liver, which processes medications, becomes less efficient. The kidneys, which filter waste and drugs out of the bloodstream, slow down. The cardiovascular system becomes more sensitive. All of this means that medications that were once harmless or even beneficial can begin to carry new risks. The same dose, the same pill, the same routine, but a completely different effect on the body. One of the biggest challenges in modern healthcare is something called polypharmacy, which simply means taking multiple medications at the same time. It's incredibly common in older adults. Many people over 60 are taking 5, 10, or even more pills every single day. And while each medication might serve a purpose individually, the combination can create a complex web of interactions and side effects that are often overlooked. The truth is, most people don't fully understand what they're taking. They trust the prescription. They follow instructions, but they don't ask questions, and that's where problems begin. Let's start with one of the most commonly used types of medication in the world, pain relievers known as non-steroidal anti-inflammatory drugs, or NSAIDs. These include familiar names like ibuprofen and naproxen. People take them for headaches, joint pain, back pain, arthritis, almost any kind of discomfort. Because they're available without a prescription, they're often seen as harmless, but that perception can be dangerously misleading. Research has shown that regular use of these medications can significantly increase the risk of heart attack and stroke, especially in older adults. The reason lies in how they affect the body. NSAIDs can cause fluid retention and increase blood pressure. Over time, this added strain on the cardiovascular system can become serious. What's even more concerning is that these risks don't require years of use. In some cases, they can begin within weeks. Many people don't connect the dots. They take a pill for pain relief and never consider that it could be affecting their heart. But doctors often see the pattern clearly. A patient comes in with rising blood pressure that doesn't respond to treatment. After reviewing their medications, it turns out they've been taking NSAIDs regularly. Once the medication is reduced or replaced, the blood pressure improves. The connection is real, and it's more common than most people realize. Next, consider decongestants. These are the medications people turn to when they have a cold or the flu. They're designed to clear nasal passages and make breathing easier. Sounds simple enough, but the way they work is by constricting blood vessels, and not just in the nose, throughout the entire body. For someone young and healthy, this might not cause a noticeable problem. But for someone over 60, especially with existing cardiovascular issues, this can lead to dangerous spikes in blood pressure. In extreme cases, it can trigger a heart attack or stroke. The risk becomes even greater when these medications are taken without awareness of underlying conditions. What makes this especially concerning is how casually these medications are used. People take them for a few days during a cold, thinking it's no big deal. But during that time, their cardiovascular system may be under significant stress. Then there are proton pump inhibitors, commonly used for acid reflux and heartburn. These medications are incredibly effective and can be life-saving when used appropriately, but they were originally intended for short-term use. The problem is that many people end up taking them for months or even years. Long-term use has been linked to an increased risk of cardiovascular issues. One of the reasons is that these drugs may interfere with the production of nitric oxide, a molecule that helps keep blood vessels relaxed and functioning properly. Without enough nitric oxide, blood vessels can become stiff and narrow, increasing the risk of heart problems. Additionally, prolonged use of these medications can lead to magnesium deficiency. Magnesium plays a crucial role in heart health, including maintaining a normal heart rhythm. Low levels can increase the risk of irregular heartbeats, which in some cases can be life-threatening. The subtle nature of magnesium deficiency makes it even more dangerous, as symptoms often go unnoticed until the problem becomes severe. Antibiotics, particularly certain types, also deserve attention. Some commonly prescribed antibiotics can affect the electrical system of the heart. They can alter the timing of heartbeats, increasing the risk of dangerous arrhythmias. While these medications are sometimes necessary, they are often prescribed more liberally than needed. In many cases, infections are viral and don't require antibiotics at all. This highlights an important point. Not every prescription is absolutely necessary. And asking questions doesn't make you difficult, it makes you responsible. Finally, there are certain antidepressants. Mental health is incredibly important, and these medications can be life-changing for many people. But like all medications, they come with risks. Some types can affect heart rhythm, blood pressure, and overall cardiovascular stability. Others may interact with medications commonly used by older adults, increasing the risk of complications. The key here is not fear, it's balance. The goal is not to avoid treatment, but to ensure that treatment is appropriate, monitored, and as safe as possible. When you step back and look at the bigger picture, a pattern emerges. It's not that medications are bad. In fact, they save lives every single day. The issue is how they're used. Over time, medications can accumulate. New prescriptions are added without fully reassessing the old ones, and gradually, the risk increases. This is why regular medication reviews are so important. Every pill should have a clear purpose, every combination should be evaluated, and every patient should understand what they're taking and why. There's also another side to this conversation that often gets overlooked: lifestyle. While medications can manage symptoms, lifestyle changes can address root causes. Simple habits like regular physical activity, a balanced diet, quality sleep, and stress management can have a profound impact on health. Walking for just 30 minutes a day can improve heart health, lower blood pressure, and boost mood. Eating whole, unprocessed foods can reduce inflammation and support overall well-being. Getting enough sleep allows the body to repair and maintain itself. These are not small changes, they are powerful tools. In many cases, improving lifestyle can reduce the need for medication. And even when medication is necessary, these habits can enhance its effectiveness and reduce risks. At the end of the day, the most important takeaway is this: you have a role in your own healthcare. You are not just a passive recipient of prescriptions. You are an active participant. You have the right to ask questions, to understand your treatment, and to make informed decisions. Take a moment to review what you're taking. Write it down. Talk to your doctor. Ask if each medication is still necessary. Ask about alternatives. Ask about risks. These conversations can make a real difference. Knowledge is one of the most powerful tools you have, and now you have information that many people don't. Use it wisely. Protect your health. And remember, small, informed decisions today can lead to a longer, healthier life tomorrow. As we continue this conversation, I want you to shift your mindset slightly. Up until now, we've been talking about specific medications and the risks they may carry. But this next part is even more important because it's about how these risks quietly build over time without most people ever noticing. Think about this for a moment. When something causes immediate pain, we react quickly. If you touch a hot surface, you pull your hand away instantly. But when damage happens slowly, silently, over months or years, it's much harder to detect. And that's exactly how many medication-related risks develop. Gradually, subtly, and often without obvious warning signs. This is especially true when it comes to the heart. Your cardiovascular system is incredibly resilient, but it's also very sensitive to long-term stress. Small increases in blood pressure, slight changes in heart rhythm, mild fluid retention. These may not feel like a big deal day to day, but over time, they add up. And when multiple medications contribute to these effects simultaneously, the impact can become significant. Let me give you a real-world example that illustrates this perfectly. Imagine someone in their mid-60s. They're taking a daily NSAID for joint pain, a proton pump inhibitor for acid reflux, and occasionally a decongestant when they catch a cold. On top of that, they're prescribed medication for blood pressure and maybe something for sleep or mood. Individually, each of these medications might seem reasonable, but together they create a perfect storm. The NSAID raises blood pressure and causes fluid retention. The decongestant constricts blood vessels, pushing blood pressure even higher. The proton pump inhibitor affects blood vessel function and reduces magnesium levels, which can impact heart rhythm. Meanwhile, other medications may interact in ways that further strain the cardiovascular system. None of this happens overnight. There's no alarm bell, no flashing warning sign. But over time, the risk builds. And then one day, something happens. A heart attack, a stroke, an irregular heartbeat that sends them to the emergency room. And it feels sudden, unexpected, out of nowhere. But in reality, it wasn't sudden at all. It was the result of a slow accumulation of effects that went unnoticed for years. This is why awareness is so powerful. Because once you understand how these pieces fit together, you can start to take control. One of the most important steps you can take is something surprisingly simple. Keep an updated list of every medication you use, not just prescriptions, but over-the-counter drugs, supplements, herbal products, everything. Most people underestimate how important this is. They might remember their main prescriptions, but forget about the pain reliever they take a few times a week or the cold medicine they use during flu season. But from a medical perspective, all of it matters. When you bring a complete list to your doctor, it allows them to see the full picture. They can identify potential interactions, unnecessary medications, and safer alternatives. Without that full picture, even the best doctor is working with incomplete information. Another critical step is asking better questions. Instead of simply accepting a prescription, try asking, why do I need this medication? How long should I be taking it? What are the potential side effects, especially for my heart? Are there safer alternatives? What happens if I don't take it? These questions don't challenge your doctor. They support better care. Good doctors welcome informed patients because it leads to better outcomes. There's also something else that deserves attention: the concept of default continuation. Many medications are started for a specific reason: an injury, a temporary condition, a short-term issue. But once started, they often continue indefinitely without reassessment. A pain reliever prescribed years ago becomes part of a daily routine. A stomach medication meant for a few weeks turns into a long-term habit. And over time, no one stops to ask if it's still necessary. Breaking this cycle can be incredibly powerful. Sometimes reducing or stopping a medication under medical supervision can lead to noticeable improvements: better energy, improved blood pressure, fewer side effects, and even better overall quality of life. Now let's talk about something that might surprise you. Your body often gives you subtle warning signs before serious problems develop. These signs are easy to ignore because they don't feel urgent. But they matter. Things like feeling more fatigued than usual, experiencing occasional dizziness when standing up, noticing mild swelling in your legs or ankles, having brief episodes of a racing or irregular heartbeat, getting short of breath more easily. Individually, these might not seem alarming, but together they can signal that something isn't quite right, possibly related to medication effects or interactions. Listening to your body is one of the most underrated skills in healthcare. Now, let's shift to something empowering: what you can actively do to protect your heart moving forward. First, prioritize movement. You don't need intense workouts or complicated routines. Even simple, consistent activity like walking can have profound benefits. It improves circulation, strengthens the heart, reduces blood pressure, and helps regulate many of the systems that medications try to control. Second, focus on nutrition. The foods you eat directly impact inflammation, blood pressure, cholesterol, and overall cardiovascular health. Whole foods, vegetables, fruits, whole grains, lean proteins, and healthy fats provide the building blocks your body needs to function properly. Third, don't underestimate the power of sleep. Poor sleep affects everything from blood pressure to hormone balance. Over time, it can significantly increase cardiovascular risk. Fourth, manage stress. Chronic stress keeps your body in a constant state of alert, which puts strain on the heart. Simple practices like deep breathing, spending time outdoors, or connecting with loved ones can make a real difference. And finally, stay informed. Medical knowledge is constantly evolving. What was considered safe or standard practice years ago may be viewed differently today. Staying curious, asking questions, and keeping up with reliable information helps you make better decisions. As we wrap up this part, I want to leave you with a simple but powerful thought. Your health is not determined by a single pill, a single decision, or a single moment. It's shaped by patterns, daily habits, repeated choices, and ongoing awareness. Medications can be helpful. Sometimes they're necessary, but they should always be used thoughtfully, carefully, and with a clear understanding of both their benefits and their risks. You don't need to fear what's in your medicine cabinet, but you do need to understand it. Because when you understand it, you take back control, and that control can make all the difference.